Have you suddenly noticed your skin is getting drier or really itchy and your hair is starting to thin and your scalp's starting to feel sore? Did you know that these could be symptoms of menopause? Today, I'm going to talk about how menopause affects your skin and hair and how I, as a doctor, help my patients manage their symptoms to maintain a healthy and radiant glow. Hello and welcome to my channel. I'm Dr. Sabana. I'm a family physician specialising in skin and aesthetics. And today we're diving into an important topic, how menopause affects your skin and hair and what you can do about it. So what is menopause? Menopause, medically speaking, begins 1 year after your last period, if you're over 50, and 2 years if you're under 50. Menopause usually occurs between ages of 45 and 55. But we all know that menopause isn't just about your periods ending and about hot flushes. There's so much more to it. With estrogen levels dropping significantly, it creates a long list of symptoms. There's brain fog, there's joint pains, there's extreme tiredness, there's tinnitus, and the list just goes on and on. Today, I'll be focusing on the impact reducing estrogen levels has on our skin and hair. But if you would like me to do another video on all the other symptoms of menopause, then let me know in the comments below. So how does menopause affect our skin? I'm going to focus on 8 common things that we see on our skin during menopause. Number 1, collagen loss. So what happens when the estrogen level drops? Essentially, the skin is suddenly running on empty with far less hormonal support. Without enough estrogen, the skin slowly loses its structural support. Studies have shown that women can lose up to 30% of their collagen in the first 5 years after menopause. Yes, 30%. That's a massive change. After this initial period, we continue to lose about 1 to 2% of our collagen each year. With this loss of collagen and loss of elastin, the skin becomes thinner and less elastic. You might notice it feeling more fragile or even sagging more, especially in the areas of our cheeks and jawline and around our neck. Number 2, we notice a lot of dryness. So another effect of estrogen loss is increased dryness. Estrogen helps our skin produce oils and holds onto water. Without it, the skin tends to become parched. Oil glands become less active and the skin's ability to retain moisture drops as well. That's why many women in menopause notice that their skin feels really dry and even itchy. This dryness exacerbates the appearance of fine lines and makes the skin texture look really dull. Number 3, the skin becomes thin and prone to easy bruising. With collagen loss, the skin becomes thin and more delicate. You might notice that minor bumps seem to cause bruises more easily, and that's because the supportive structure around the blood vessels is weaker, so vessels break with less trauma. In fact, as estrogen levels fall and the skin thins, it's common for bruising to happen more often. You may also see that the skin tears easily and you develop purplish patches all over the skin, and this can occur just from simple knocks. Number 4, those dreaded wrinkles and fine lines. Menopause can accelerate the appearance of wrinkles. Collagen and elastin are what keep our skin smooth when we're younger. With their decline, the skin folds and creases settle in. Many women notice increased fine lines, especially around the eyes and the mouth, and deeper wrinkles set in the forehead and around the cheek area. Some wrinkles are, of course, due to years of sun exposure and facial movements, but estrogen loss adds to it by removing that plumpiness under the skin. In short, skin that was once firm now has less support, so wrinkles form more readily. Number 5, acne breakouts. It doesn't seem fair, but in menopause, some women get acne. What's actually happening is that as estrogen levels fall, androgen levels, the male hormone, has a stronger influence, and this then increases sebum production, and the result of this is clogged pores and the occasional pimple. It's usually not severe acne, but you might notice more breakouts, especially around the chin and jawline area. If you're seeing persistent breakouts and you're struggling to manage them, then you might find these videos helpful, where I go into detail on how to treat acne. Number 6, age spots and pigment changes. So years of sun exposure often start to show up as age spots. Flat, brown spots on the face, hands, arms can be seen. While these sunspots are largely due to UV damage accumulated over time, estrogen changes can play a role in skin pigmentation too. Some women might notice new freckles or patches of darker skin all over the place. Number 7, increased sensitivity and rashes. Many women report that their skin becomes more sensitive around menopause. Many women describe this strange sensation of something crawling all over their skin or scalp, or their scalp becomes very sore and sensitive. You might even notice that you're developing rashes from products that have never bothered you before, or find that your skin gets red and irritated more easily. One reason for this is that the skin's pH changes around the age of 50 and becoming more prone to irritation. Number 8, slow wound healing. You may find that if you get a cut or a scratch, it heals more slowly than it used to. The reduced estrogen levels play a role in wound healing, and studies have shown that lower estrogen is associated with slower skin healing. Essentially, the skin's repair processes have slowed down due to the hormonal changes. Right, that sounds like a long list of woes, but remember, not everyone will experience all of these symptoms, and the degree can vary from person to person. Some lucky folk may just suffer simply from dryness and nothing else, while others may suffer from all the things I've just listed. The good news is we have so many tools and treatments to address these issues. So next, I'll go through the medical treatments available for menopausal skin changes, from hormone therapies to high-tech lasers. And make sure you stick around until the end, where I'll share the best treatments to manage hair loss and hair thinning. Now that we know what can happen to the skin, let's talk about the solutions. As a GP specialising in aesthetics, I always tailor recommendations to the individual's needs. But here are my top 5 medical and dermatological treatments that can help most menopausal skin problems. Number 1 is sun protection. This is a non-negotiable. Always use a broad spectrum sunscreen. Make sure it's an SPF 30 and above, ideally 50 and above. Make sure you're using it every day to try and prevent further collagen loss and also to prevent and protect against sun damage. Number 2, try to boost collagen with skincare products. These include retinoids and peptides. They both help stimulate collagen production and improve skin texture. Retinoids are vitamin A creams. They are the gold standard in topical anti-aging treatments. These include prescription tretinoin or over-the-counter retinol products. Retinoids work by increasing skin cell turnover and boosting collagen production. For menopausal skin, a retinoid cream can be incredibly helpful to help combat dryness and wrinkles. It basically tells the skin to act younger. Peptides are marketed to stimulate collagen or aid skin repair. You'll find them in many high-quality anti-aging serums and creams. They are gentler than retinoids and can be a nice addition to your skincare. The evidence for peptides is not as robust as retinoids, but there are some studies and a lot of anecdotal experience that suggests there is improved texture and elasticity with consistent use of the peptides. Number 3, hormone replacement therapy, HRT. HRT means taking estrogen with or without progesterone, depending on your medical history, and this is to supplement the hormones that your body now lacks. HRT is usually prescribed to help with numerous menopausal symptoms, and it can have a positive effect on the skin as well. By replacing some estrogen, HRT can improve skin hydration, improve skin thickness and elasticity, and it can even help to reduce the appearance of wrinkles. But just remember, HRT isn't suitable for everyone, so it's definitely something to discuss in detail with your doctor. Number 4, laser therapy. If you're looking for a more dramatic improvement in skin changes, then medical laser treatments is a great option. There are different types of lasers used in aesthetics. Some target the surface to get rid of age spots and improve skin texture. This is the BBL and Moxie laser and Halo laser by Cyton. These are great products to try. Other lasers go deeper to stimulate collagen, like fractional lasers. So the fractional CO2 laser or erbium lasers, they create tiny micro injuries below the skin surface and kickstart a healing process. Lasers can improve wrinkles, they can help to tighten skin, they can reduce discoloration and even out skin tone. And number 5, Botox and fillers. Botox and derma fillers are great tools to help plump up areas on the face and help reduce fine lines and wrinkles. Although it's not stimulating collagen or elastin, and it doesn't change the skin texture, but cosmetically it can reduce the appearance of wrinkles and restore volume loss. I often use both as part of a treatment plan. I find a combination of all these treatments provide the best outcome. Right, now that we've talked about skin, let's talk about hair. This is the other big piece of the puzzle. So why does scalp hair thin during menopause? The culprit here is again the hormonal shift. Hair growth is influenced by a balance of estrogens and androgens, amongst other factors. Estrogen tends to promote hair growth and keep hairs in their growing phase longer, which is why during pregnancy, where we are in a high estrogen state, many women have full, thick hair. After menopause, estrogen levels drop significantly, and there's a relative increase in the influence of androgens. This imbalance can trigger female pattern hair loss, also known as androgenetic alopecia in women. It typically looks like diffuse thinning on the crown and the top of your head. You might notice your parting widening or more scalp showing when your hair is under bright light. Unlike men, women usually don't go completely bald on top, but the hair density can decrease a lot over time. In fact, by the time women are postmenopausal, about 2/3 will experience some degree of hair thinning or hair loss. So on the flip side, why does facial hair increase? It's the same hormonal imbalance. Those androgens we just talked about can have the opposite effect on the facial hair follicles. Areas like the chin, upper lip and jaw may develop coarser, darker hairs. Studies indicate facial hirsutism, excess hair, appears in about 40 to 50% of women after menopause, so it's extremely common. So what can we do about these hair changes? There are quite a few medical treatments and interventions that you can consider. Number 1, minoxidil. This is a topical treatment. This is often the first-line treatment for scalp hair thinning. Minoxidil is available over the counter, often under the brand name Regain. It's in a liquid or foam form, and you can apply it to the scalp daily. It works by revitalizing shrunken hair follicles and extending the growth phase of your hair. In women, a 5% topical minoxidil once a day is commonly recommended. It can significantly slow down hair loss and in some cases even regrow hair, but you do need to be patient as results usually start to show about 3 to 6 months of daily use. Number 2, prescription medications. Since hormones play a big role, certain prescription pills can help by blocking the effect of androgens on the hair follicles. 2 commonly used medications are spironolactone and finasteride. The evidence for their effectiveness in women varies, but many dermatologists have patients who've seen improvements with these medications as part of a comprehensive plan. Number 3, PRP. Platelet-rich plasma therapy. PRP is an innovative treatment that has gained popularity recently and is used quite often for hair loss. It involves drawing a small amount of your own blood, processing it in a special machine to concentrate the platelets, which are rich in growth factors. And then these growth factors are then injected into the scalp. The idea is that these factors stimulate hair follicles to grow. The science behind PRP is still questionable. We're not sure if it's the collagen stimulation from the needle trauma that's actually causing hair growth, or whether it's the growth factors from the process of PRP that's causing the hair growth. But it seems to work for a lot of patients, and I guess in years to come we'll have a bit more evidence and more research into how it's actually working. So with regards to treating excess hair growth on the face, the approach is a little bit different. We are obviously looking at reducing hair growth rather than regrowing it. So there's a couple of options. One is Vanica cream. This is a prescription-only cream, and it helps to slow down hair growth. The problem with this cream is that when you stop using it, it stops working. And then the other option is laser hair removal. This is more of a long-term hair reduction solution, and it works by a focused light beam that targets the pigment in the hair follicles. It heats it up and destroys them so they can't grow back, or grows back much less. Laser hair removal can provide a significant and lasting reduction in hair growth after a series of multiple sessions. Hair changes can be emotionally tough. After all, our hair is a big part of our identity. I always remind my patients that treating hair loss is a long game. Unlike skin, which might glow after a peel in a week, hair can take 6 to 12 months of sticking with a treatment to really see improvement. So don't get discouraged, stick with it. Medical treatments are important, but there's a lot that you can do in your daily life to support healthy skin and hair through menopause. Lifestyle and self-care measures can make a big difference in how you look and how you feel. So make sure that you remember to have a good intake of protein in your diet, make sure that you're having a good amount of healthy fats in your diet, keep hydrated, stop smoking, make sure you're sleeping well, and obviously try and manage your stress. So to wrap it up, I want to leave you with a positive note. Menopause is a natural phase of life. It does bring changes, some which can be challenging or unwanted, but it's also a time of new beginnings. No more periods? When it comes to skin and hair, yes, you will notice differences as we've discussed. Maybe a few more wrinkles, a bit less hair, or new quirks like dryness or age spots. But the important thing is you're not powerless in the face of these changes. There are so many effective treatments and strategies available today to help you look and feel your best. Thank you for joining me in this detailed look at menopause's effects on skin and hair. I hope you found this information helpful and empowering.